In this section you will learn about writing the introduction of your research proposal.
Once we have gathered and read the literature related to our research topic, it is time to write the introduction and the problem statement. A problem is everything that becomes a reflection object and on which there is a need to learn, explain, and study. While looking for references on Google Scholar, if you click on the quotes you get the citation in different citation styles. Remember that you have to adopt the one suggested by your academic advisor.
With the information you must answer the following. How much do you know about the research topic? What do you want to know about the topic? Do you require additional information than you already have? Have you found out relevant, current and pertinent information?
To write the introduction, what you have to do is to contextualize the topic for your readers so that as they read your text, they understand why your topic is significant and you introduce a problem with that topic, and you also need to write a research question that needs to be answered. Part of the following example was taken from Medscape, updated, May 14, 2021. Author, David J. Senemo, MD, FOP, FACP, EVS, Chief Editor, Michael Stewart Bronze, MD, and Coronavirus, COVID-19, in Mexico. Statistics and Facts, published by Eric Berguino Oz, May 28, 2021.
Start contextualizing the problem, define some terms, give figures and citations. Then you can use the following template to write the problem statement. There is a problem in or with topic. Despite something that should be happening is occurring, provide evidence after this statement. This problem has negatively impacted organizations or people affected by the problem, because, give reasons, figures and citations. A possible cause of this problem is, write the cause, and perhaps a study which investigates the cause-effect relationship could remedy this situation. Write the problem from the general to the more specific.
Coronavirus disease 2019, COVID-19, is defined as illness caused by a novel coronavirus called severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, formerly called 2019 CoV, which was first identified amid an outbreak of respiratory illness cases in Wuhan City, Hubei Province, China. CDC, 2019. It was initially reported to the World Health Organization, WHO, on December 31, 2019. On January 30, 2020, the WHO declared the COVID-19 outbreak a global health emergency. Gallegos, 2020. On March 11, 2020, the WHO declared COVID-19 a global pandemic, its first such designation since declaring H1N1 influenza a pandemic in 2009. The New York Times, 2020. Outcomes from COVID-19 disease in young adults have been described by Cunningham and colleagues. Of 3,200 adults aged 18 to 34 years hospitalized in the U.S. with COVID-19, 21% were admitted to the ICU, 10% required mechanical ventilation, and 3% died. Comorbidities included obesity 33%, 25% overall were morbidly obese, diabetes 18%, and hypertension 16%. Independent predictors of death or mechanical ventilation included hypertension, male gender, and morbid obesity. Young adults with multiple risk factors for poor outcomes from COVID-19 compared similarly to middle-aged adults without such risk factors. Cunningham, 2020. As of May 14, 2021, confirmed COVID-19 infections number over 160.8 million individuals worldwide and have resulted in over 3.3 million deaths. WHO, 2021.
Presentations of COVID-19 have ranged from asymptomatic, mild symptoms to severe illness and mortality. Common symptoms have included fever, cough, and shortness of breath. CDC, 2020. Other symptoms, such as malaise and respiratory distress, have also been described. WHO, 2020.
The first cases of COVID-19 in Mexico were reported at the beginning of 2020. By the end of May, the number of infections already surpassed 100,000, and in November it reached 1 million, with the number of deaths nearing 100,000. However, values may have been underestimated due to a lower testing rate at the beginning of the pandemic. A year later, as of May 2021, over 2.3 million cases and 200,000 deaths had been documented, with Mexico City as the federal entity with the highest number of them.
The initial position taken by President Andrés Manuel López Obrador regarding the pandemic was not well received by the Mexican public and the international media as well. The Mexican head of state seemed to ignore experts' recommendations by shaking hands publicly, holding rallies, not wearing a face mask, and always trying to minimize the severity of the situation in public press conferences.
However, the government ended up declaring a national health emergency on March 30, 2020. Since that day, all non-essential activities in the public and private sectors were suspended, reinforcing the social distancing actions implemented a few weeks prior. In the following months, the government enforced a system in which activities would go back to normal, contingent on the risk level in each state. Additionally, a vaccination campaign against COVID-19 started in Mexico in December 2020. By May 2021, around 9% of the population have been fully vaccinated.
The restrictions enforced by the government to control the spread of the virus, and the sanitary crisis itself have had a direct impact on Mexicans' everyday life. A significant part of the labor force adopted home office practices, which was not so common in the country in previous years. With more time spent at home, increased demand for news and social media was detected. Consumer behavior among Mexicans was affected as well, with an increase in the use of hygiene and protection products such as face masks, antibacterial gel, gloves, and face shields, and a significant decrease in the demand for certain categories of products and services, such as hotel stays and out-of-home entertainment.
Children and learners of all ages have also been strongly affected. Distance learning became the norm in the months following the beginning of the pandemic, forcing some students to abandon their education, and particularly there is a developing problem with the graduation rates in higher education in Mexico. Despite the efforts to contact and speak with the college students on the consequences for their future and aids provided by state governments, universities and the heads of the academic departments and tutors, high dropout rates are occurring, which has affected about 200 college students at the Huichapan Higher Education Institute. Senior Vice Presidency, 2021.
This problem has negatively impacted 10% of students at the Huichapan Institute of Higher Education because many will not graduate. Senior Vice Presidency, 2021. Some possible causes of this problem are online classes, absenteeism, loss of job, COVID-related health problems, and even death, among others. Perhaps a study which investigates the effects of the COVID pandemic in regards to the graduation rate and how they could be addressed might help improve the graduation rate in the academic program of architecture. Notice that the text goes from the general to the more specific.
Now we should move forward to the research question. Remember, you have to establish the effect of variable x on variable y, and there are 4 components that the research question has to include. 1. Focus on a specific topic, not too broad because you may not have time to gather the data, and not too specific or you may end up with no data at all. 2. Scope, a specific time, place, group, organization, etc. 3. Significance. Is it important to answer this question? Try to find a topic that has an impact on public health or a high cost on organizations for higher significance. 4. Feasibility. Do you have the skills and resources necessary to carry out the study?
The research question in this case could be, what is the variable with major impact on the student graduation rate of architecture at the Huichapan Institute of Higher Education? What we would like to answer is what is causing this problem. What possibly could fix this problem?
From the beginning, you need to start thinking about the following: for this case, approach, exploratory; design, non-experimental; method, qualitative, survey.
Now it's your turn.
Answer these questions. You are going to record yourself answering these questions. You are going to record the synthetic voice and your voice as if it were a conversation. You have from 30 to 40 seconds to answer. Give complete answers, give reasons, use all the time you need to answer, don't stop speaking. The file type you submit to your teacher must be MP3. If you need more time, stop this video and record your answer, then resume this video and continue with your recording.
You are going to practice several times answering these questions. When you think you are ready, record yourself with the speech-to-text microphone in WhatsApp in your cell phone. If it shows the words that you are saying, then your pronunciation is correct. If not, check your pronunciation. Find a voice synthesis application so that you copy and paste what you are trying to say and listen to how the words are pronounced. Then try again until you pronounce correctly. When you are able to pronounce correctly, then record the questions and your answers using your cell phone and submit it to your teacher.
1. Escucha las preguntas primero. 2. Escribe tus respuestas. 3. Practica leyendo tus respuestas con tu celular en el modo de voz a texto para que verifiques que se escriben correctamente las palabras que dices. También puedes usar otro programa de reconocimiento de voz o de dictado. 4. Cuando pronuncies bien, graba la conversación. Si pronuncias mal, no envíes tu archivo hasta que lo hagas correctamente.
What is the literature matrix and why is it a key element to identify the research gap and how it will help you write the problem statement and the literature review? What are 4 components that the research question has to include? When writing the problem statement, why do you have to go from the more general to the more specific? How does the research question have to be written? Describe how you can get a citation while working on Google Scholar.
This is the end of the session. See you in our next Hands on the Writing a Research Proposal Flipped Classroom session.